Having a baby or becoming a parent is a tremendously life-changing event, however you look at it. Physically, while you may feel like you've been hit by a train, your body will recover, and the better shape you're in going into the pregnancy and parenthood, the quicker you're likely to bounce back. So it's always a good idea to take care of yourself, mind and body. Your vaginal bleeding will go away about 4 to 6 weeks after delivery, and your period will resume after that, depending on breastfeeding patterns and duration. Many women find they're very fertile after they've just had a baby, so if that's not your intention, make sure to speak with your partner and provider about birth control, but avoid birth control pills if you're breastfeeding, as they could decrease milk supply. Your abdomen will shrink as your uterus goes back to its normal size and location, though it's common to keep some extra weight in the abdomen for several months, especially if you're breastfeeding. It requires more calories to breastfeed than carry the baby when you were pregnant, so you'll likely have a good appetite and still lose pregnancy weight little by little. Your perineum and vaginal structure will return to normal, though things might feel a little different down there after a baby. There are exercises you can be doing during pregnancy and certainly after, Kegels being the most important probably for tone and function. And there are therapists who specialize in pelvic floor rehabilitation if you're experiencing issues. Another huge consideration after pregnancy is the emotional transition of becoming a parent, but for moms especially. Between the hormones and sleep deprivation, on top of the process of delivering your baby and the life-altering reality of now keeping another human being alive, you may experience a wide range of emotions in those early days. Dads can experience a wide range of emotions as well from these experiences, so speak up and share with your partner. People refer to the baby blues, and your feelings and moods are truly all over the place. You might experience weepiness, sadness, or anxiety. You may lack concentration or have feelings of dependency or inadequacy. These are all normal in the first couple of weeks. If these feelings persist, however, and certainly if they get worse, you need to reach out for help from your OB, your child's pediatrician, or a mental health provider. The reality is you won't be any use in caring for your baby without caring first for yourself. It can be helpful to keep an open dialogue about how you're feeling and what you're experiencing with your partner, as they've known you throughout this process. Sometimes just speaking about it, sharing or verbalizing your thoughts can help you feel better. And sometimes this person who has known you before pregnancy and before your baby may be the voice of reason who suggests reaching out further if needed. The bottom line is that there are a lot of changes and transitions going on, and it's important to share them as you need to so you can be present and available to your family. Here are a few tips to ease the transition to parenthood in the early days. Try to simplify your life by choosing easy-to-prepare meals and making extras so you have leftovers. Limit your outside obligations. Don't commit to many things in those early days, as they're more about snuggling and resting and getting things like bonding and feeding off to a good, relaxed start. Getting out of the house with or without your newborn takes practice, but rushing it isn't good for anybody. Leisurely walks in the neighborhood are great first outings and become even better routines. Let the housework go or hire help. You're busy feeding the baby, so the most help is someone who can cook and clean for you. Limit visitors, especially those who aren't helpful. Don't be afraid to use your voice to set boundaries about what you and your new family need. If someone is visiting and they're unwell or sick, they need to come back when they're healthy. Even though breastfed babies are protected by antibodies from the mother's milk, if the baby does get sick and develops a fever before they're 8 weeks old, they'll need a full sepsis workup, which includes a spinal tap. It's just not worth the risk to the baby getting sick in those early days. And if anyone is coming to visit and asks what they can bring, you should always ask for prepared food. You probably don't need another blanket for the baby or a stuffed bear, but prepared food is incredibly helpful and can be nice to sit around together and eat a warm meal while someone else holds the baby for you and loves doing so. Try making a running to-do list, and visitors who really want to help can tackle a project or cross something off the list for you. You can sit and fold laundered baby clothes together, or tell them where dishes go as they unload the dishwasher while you sit nearby nursing the baby. As a lactation consultant and lactivist, I really hope the days are gone of new moms retreating to the nursery to feed their babies. Whoever comes over should be prepared to see you feed the baby, and they can step out while you latch and get comfortable. You have the legal right to breastfeed your baby wherever you want in all 50 states, so exercise your right in your own home. While there's a lot of newness when you bring baby home and transition to life as a family, it's a really magical time. You're still you at your core. Your partner is still the same person. You both get to gush over this new thing you created, who will too soon need you less and less. Relish in the nighttime feeds when this little person can't last more than a few hours without you. Snuggle and kiss your baby and each other, as no other time in your life will be as intense but fleeting as these days with your newborn. Be tired, be present, be in awe. Congratulations, you're going to be great.